So now we're going to talk about mother-to-child transmission, which is the third way or the third mode of HIV transmission and how it can be passed from one person to another. A mother can pass on HIV to her child if she is HIV positive during 3 times of her pregnancy. And I'm going to talk about the ways or the times that it can be passed, and right after that I'm going to talk about the prevention, because there are specific preventions based on the time period. So the first way that HIV can be passed is during pregnancy, or in the womb. Yeah, what's that word? In the womb. So when a baby is growing inside of a mother's stomach, it's protected by the placenta, which surrounds the baby and keeps mother and baby's blood separated. In some rare instances, due to trauma or other unforeseen consequences, the placenta is torn. And if the placenta is torn or damaged, then HIV positive blood from the mother can get into the child and infect the baby that way. In order to prevent this, we recommend that mothers who are HIV positive are started on antiretroviral treatments during their pregnancy as soon as they find out if they're HIV positive. Antiretroviral treatments are the recommended treatments for people who are HIV positive, and the point of them is to lower someone's viral load. And if someone has a low viral load, if a mother has a low viral load, then her blood doesn't have a lot of HIV in it, and then if that blood is transmitted to the baby, the risk of transmission is fairly low. The second way, or the second time that HIV can be passed, is during labor and delivery. So once a baby has been inside mom's stomach for 9 months, it's time for it to come out into the world. Labor and delivery is a very stressful process on both the mother and the child. Specifically during vaginal birth, a baby is put through a very tiny space, and there can be a situation where open wounds can be created on the baby's skin. And so while a baby is, or during delivery, that baby, if it has open wounds on its skin, can come into contact with blood or other vaginal fluid from the mother, and that's how HIV can be passed. So if blood or vaginal fluid gets inside of the open wounds during delivery, then HIV can be passed. In order to prevent this, we recommend that mothers who are HIV positive have a cesarean operation. And this is an operation where the doctor cuts open the mother's stomach and takes the baby out that way. It's much less stressful on the baby and lowers risk of transmission significantly. And this is a safe operation for mothers to have. The third time that HIV can be passed is during breastfeeding. So mother's milk is one of our fluids that contains HIV and can transmit HIV. So during breastfeeding, if an HIV positive mother is continually breastfeeding her child, there's a chance that HIV can be passed. Now, is the mouth a door? No, right, so the mouth is not a door. So let's try to think of a way that HIV could be passed if the mouth is not a door for HIV to be transmitted through. What happens when a baby is about 6 months old?
Teething.
Exactly, yep, they start to get teeth in their mouth. And when they get teeth, that creates open wounds inside of their mouth, and HIV positive breast milk or mother's milk can get inside of those open wounds and transmit HIV. In order to prevent this, we recommend that mothers breastfeed for only 6 months and stop after 6 months, and then move to formula feeding or another form of feeding. It's not recommended that mothers breastfeed and formula feed at the same time or switch off, because that creates an acidic environment in the mom's stomach, and in that case, HIV could be transmitted. So something really important about mother-to-child transmission is that the only way to prevent this really is besides these ways, is for every woman who gets pregnant or is of childbearing age should get tested for HIV. Because if we can test mothers and determine if they're HIV positive or negative, then we can immediately start them on antiretroviral treatments, and the risk of transmission goes significantly down. Currently, if a mother is not on ARTs, they have a 30% chance of transmitting HIV to their child, and if they are on ARTs, they have almost a 0% chance. So getting tested is incredibly important and can really impact mother-to-child transmission. Any questions?
What was the percentage?
30% with no antiretroviral treatments. Between all three of the ways. Any other questions?
You could also use an example for that. So you could say, so if we had 100 pregnant women at the hospital and they're all going to give birth that day, and say they all have HIV. We have 100 HIV positive pregnant women that are going to give birth. They all give birth, about 30 of them will pass HIV on to their baby. But if all these same 100 women got tested and they knew they had HIV and they used those steps to prevent HIV being transmitted, being on ARV treatment, getting a cesarean operation, the chance is that most likely none of those babies will get HIV. So from 30 to 0, most likely. So preventing mother-to-child transmission is very effective, and that's why it's very important for a mother to get tested, because it is nearly 100% effective at preventing transmission.